Healthcare's biggest problem is not a lack of innovation. It is that we keep innovating around the patient instead of around the people caring for them. A nurse became a cancer patient, and she learned something healthcare leaders often miss. The hardest part of healthcare is not always the disease. Sometimes it is the system surrounding the disease. For years, Kristen Surtee stood beside patients as a nurse. She understood treatments, protocols, and procedures. Then cancer changed her perspective. She became the person waiting for answers, the person reading unfamiliar reports, the person hoping someone would explain what happens next. She discovered what no textbook could teach. Patients do not remember healthcare as a workflow. They remember how the system made them feel. The physician who listened, the nurse who noticed fear, the person who made uncertainty feel manageable. When Kristen returned to oncology, she brought back something more valuable than experience. She brought empathy earned from the other side of the bed. That lesson applies far beyond oncology. Because healthcare's biggest challenge today is not a shortage of intelligence. It is a shortage of connected intelligence. We can perform robotic surgeries. We can analyze genetic data. We can build powerful artificial intelligence models. Yet many physicians still spend hours asking, why was this claim denied? Why did reimbursement fail? Why did a documentation issue appear after the patient already left? That is the uncomfortable contradiction of modern healthcare. We are becoming better at treating disease while remaining inefficient at supporting the people delivering that care. Physicians trained for years to solve medical problems. They did not train to become insurance negotiators, coding analysts, or revenue cycle detectives. But many practice owners now spend their evenings managing administrative complexity instead of improving patient care. Maybe physician burnout is not simply a resilience problem. Maybe it is a system design failure. We created a healthcare environment where some of our most valuable professionals spend too much time fighting the system and not enough time healing within it. Here is the contrarian view. Healthcare does not have a billing problem. Healthcare has a prevention problem. A denied claim is usually not created when the denial happens. The failure started earlier. A missing piece of information, a documentation gap, a disconnected workflow, a decision made without enough visibility. By the time the denial appears, healthcare is already playing defense. The future is not building faster ways to fix mistakes. The future is building smarter ways to prevent them. The biggest opportunity for artificial intelligence in healthcare is not replacing people. It is protecting human attention. The best healthcare technology should not create another dashboard. It should create better decisions. It should help physicians understand what requires attention, where is risk developing, what can be prevented today. Technology should not make healthcare feel more complicated. It should make healthcare feel more intelligent. The next generation of medical practices will not win because they work harder. They will win because they remove unnecessary friction. The practices that thrive will understand. Clinical excellence requires operational excellence. Patient trust includes financial transparency. Physician sustainability depends on better systems. The future of healthcare will not only be discovered in laboratories. It will be built in the invisible systems that support every patient encounter. Because the greatest healthcare innovation may not be a new treatment. It may be giving physicians back the time, focus, and clarity to deliver the care they were trained to provide. What is one administrative problem in healthcare that we have accepted for too long as just the way things work? I would like to hear your perspective. Comment below, share your experience, and repost this if you believe healthcare needs smarter systems, not just more technology.